Hi there, I'm Dr. Tim Fargo. Welcome to another one of our videos on scoliosis. In the last two, first one I talked about was the actual definition of scoliosis. The second one, we talked about how to detect it in yourself, in a loved one. And in this session, we're going to talk about what do we actually do to treat scoliosis. There are a range of different curve magnitudes or severity and age groups that are affected by scoliosis. For example, if a curve is very small, could be under 10 degrees, but the point is a very small curve where there's a very low risk of progression, the conventional wisdom is that you simply watch and wait to see what happens with the curve. However, if there's any risk of progression, and particularly with young people, we want to get aggressive with these curves because they can quite quickly move from here all the way to here, and this can happen in a matter of months. So some of the treatment options that exist could be such things as chiropractic care to specifically create mobility in the involved spinal joints, make sure the spine stays loose. I will say too, this is very true for adults, even older adults. Chiropractic care and adjusting or manipulation can make a very big difference in terms of the ability of the spine to adapt and stay mobile. In addition, scoliosis-specific exercises wherein we're working the actual muscles to help counterbalance the scoliosis curves can be very effective. In addition, there are chiropractic methodologies which are specifically addressed to change the structure of the spine. An example of this is chiropractic biophysics, which uses a combination of mirror image, which means if a curve is this way, a mirror image of that would be this way. Uses mirror image exercises both in office and at home. Uses mirror image traction therapies. Once again, if a curve looks like this, then we would simply traction the spine this way to influence both the ligaments and the discs. These types of methodologies can be very effective, particularly when curves are of relatively smaller magnitude and are flexible. The equation does change, however, when the curves become greater, when there's a high risk of progression. At that point, we want to use bracing. Bracing can be very, very effective, particularly in combination with the other modalities that I mentioned. Bracing can be and has been shown in the literature to be the most effective way of actually retarding the progression and, in some cases, even correcting to some measurable degree scoliotic curves. I'll talk in my next video about bracing specifically. I should mention at this point that there are cases where the curve is either so great that it's putting, for lack of a better word, pressure on or creating compromise of the heart, of the lungs, where there's threat to other internal organ systems, where the person's in tremendous pain. There are instances where surgery can be done, has been done, but this is really a choice of last resort. Surgery is very significant. It's a major thing. In any case, all of these decisions are driven by a number of different factors. One, whether the person has pain. Two, the magnitude of the curve. Three, the risk of progression. Four, and strangely, a lot of times this becomes a driving factor for people, such things as posture and the cosmetics of the situation. As I said in my next video, I'm going to talk a little bit more about bracing specifically, and I look forward to seeing you then. Have a great one.